Have you ever gone to a doctor and just sat there thinking, how the heck is this guy a doctor? Well, I've had my fair share of moments where I couldn't help but wonder if these medical professionals even know what they're doing. Let me start with a little history about me. From the moment I was born, doctors diagnosed me as having no thyroid gland. Imagine that, right? No thyroid. So, since day 2 of my life, I've been on 50 micrograms of Synthroid every day. It wasn't a huge deal. I just took the pill and carried on with life. Every 6 months, I'd visit my doctor. He would glance at my charts, see that everything seemed normal, and he'd just renew the prescription every time, no questions asked. But something seemed off. When I hit my teenage years, I started to notice that I was still on the same dosage, year after year. Meanwhile, my mom, who also had an underactive thyroid, was on a dosage that was more than 3 times mine. Shouldn't that have set off an alarm? But I kept thinking, hey, my doctor knows best, right? He must. I didn't question it, just went along with it. Fast forward to when I was 20. I wanted to join the Air Force. I'd always wanted to be part of something big, something that meant something. But guess what? I got rejected. The reason? My medical status. I'm sure a thyroid thing had something to do with it. I was 23 when I moved about 45 minutes away and got a new doctor. The first time I walked into his office, I handed him my medical records from my childhood doctor. He skimmed over them and then stopped. Why have you been on the same dosage your entire life? He asked, looking at me with concern. He even went as far as to do an ultrasound on my neck, like they do for pregnant women. In no joke, 5 seconds, he found my non-existent thyroid. I was stunned. My whole life, I had been under the impression that I was born without a thyroid, and this doctor finds it in seconds. As I walked out of his office, my mind was racing. How had my previous doctor missed this for so many years? He didn't even put the pieces together. I felt a mix of anger and disbelief, and for the first time in my life, I thought, how the heck is this guy still practicing medicine? I wanted to scream, to call him up, and demand some kind of explanation. How was it that he had misdiagnosed me for 20 years? That was the start of me questioning every doctor I'd ever seen. And from that point, it became a habit. You can never be too sure when it comes to your health. Right then, as a paramedic, I got to see things from a whole different perspective. It's not always about fixing the patient in the back of the ambulance sometimes. It's about what happens when they get to the hospital. For example, I remember one doctor in particular. We brought in a patient who had been in a terrible, crippling car accident. Standard protocol is to place anyone with back pain on a backboard to keep their spine immobile. Why? Because if you move someone with a spinal injury, you could end up paralyzing them. But not this doctor. The first thing he did was remove the straps from the backboard, get the patient sitting up, and start feeling around their spine to make sure it wasn't broken. Yeah, you read that right. Instead of keeping the patient immobilized, this doctor was feeling around, moving them all around like it was no big deal. I was stunned, and my mind instantly went into what the heck is going on here. Mode? It wasn't until later that I realized this wasn't just some quirky doctor. He had a habit of doing things that just didn't sit well with me. How can someone in charge of a patient's health be so reckless? And if I'm being honest, I think every single person who has ever been in the medical field, whether it's as a nurse, paramedic, or someone who's had a few run-ins with doctors, can relate to that feeling when you walk into a doctor's office or an ER and you have that brief moment of doubt. You know, the one where you're just not sure if you should trust the person standing in front of you with your health. It's a terrifying feeling, knowing that these people have such an important job. But how can you be so sure they're doing it right? Speaking of doctors doing it right, or rather, not doing it right, let me share another story. This wasn't exactly an incompetent doctor story, but it sure felt like it in the moment. I went to a doctor because I was suffering from what turned out to be strep throat. The nurse took my details, and then the doctor came in. One of the first questions he asked was whether there was a chance that I could be pregnant. Well, honestly, yes, there's always a chance, right? But I assured him that the probability was low, especially since I'd used protection. Instead of addressing what I actually came in for, he started lecturing me about unprotected intimacy. I told him I always use protection, and he shifted his lecture to how premarital intimacy was a sin. At that point, I was over it. I didn't go in for a lecture. I just wanted antibiotics so I could get back to feeling normal. I didn't care about his personal opinions on my private life. I just needed a prescription and some relief. But no, he wouldn't stop. It was frustrating, to say the least. All I wanted was some antibiotics and to leave. Instead, I was stuck with a lecture about something completely unrelated to my actual health issue. I get that doctors are supposed to guide us, but sometimes it's just about the treatment and not the moral lectures. It was clear that the guy didn't have a clue about what I was really going through. All right? Where was I? Oh, right. We were just getting into the chaos of the medical world, so let me take you on another ride through some more absurd doctor moments. Let me go back to when I was 15. I was getting my first physical exam, and let me tell you, that experience definitely wasn't as smooth as I hoped. My doctor, after everything was over, made a bizarre comment that stuck with me. As I was struggling to clean up after the exam, he casually said, "It would be a more pleasant experience for me if you got waxed before your next physical." Excuse me, waxed. Now, I'm no expert in doctor-patient etiquette, but this felt off. But the fun didn't stop there. I had asked if I could have a nurse present during the exam. Seems like a reasonable request, right? Apparently not. He flat out refused and said, "No one else is coming in here." At that point, I didn't even know what to do with myself. I felt uncomfortable and honestly a little humiliated. Looking back, I now know my rights. But that was one of the most confusing moments as a teenager. And it didn't help that it messed with my already fragile teenage mindset. Now, let me tell you about my trip to the dentist. I was in insane pain in my lower left jaw. The pain was centered towards the front, and I was losing my mind. The dentist took a quick look and immediately blamed it on my wisdom teeth coming in at the back. I told him, "No, that's not the pain. It's here, right in front." He argued with me for 15 minutes about it, insisting that it had to be my wisdom teeth. After a while, he left the room, and I thought I was finally done with him. But nope, I wasn't. I went to see another dentist, and guess what? A filling had come loose, and I needed a root canal. How's that for a slap in the face? I'd spent all that time in pain and listening to the first dentist, only for it to turn out that I was right from the start. Screw that guy. Now, I'm sure a lot of people can relate to this next story. You ever have that moment where everyone you know is seeing the same doctor, and you think, well, if they're good enough for everyone else, they must be fine. Well, let me tell you, my entire family saw the same doctor in the small town I grew up in. At first, it seemed like everything was okay. But as time went on, the cracks started to show. My wife went to this doctor twice a year for checkups because she had some issues with ovarian cysts when she was younger. He put her on birth control pills to deal with it. Fast forward a few years, and she started feeling some strange pressure in her abdomen. So she went to see him again. He prodded around and said everything was fine. But my wife, being cautious, went for a second opinion. Thank God she did. Turns out she had a grapefruit-sized tumor growing in her uterus. She had to see a specialist to get it removed. The fibroid specialist said, "I am amazed your doctor didn't catch this. It's immediately noticeable to anyone with any medical training, and it wasn't just my wife. My wife's mom had a persistent cough that wouldn't go away. Her doctor thought it was allergies and prescribed her Claritin, but she kept feeling worse and worse. She went back to the doctor, who prescribed her some cough medicine. Well, fast forward a bit, and she was running a high fever, unable to breathe, and couldn't even get out of bed. A second doctor admitted her to the hospital with pneumonia in both lungs. I don't think I need to tell you how serious that could have been if she had just stuck with the first doctor's misdiagnosis. Then there was my grandpa. About 5 years ago, he started having problems with his hands dropping things, slurring his speech, having difficulty getting out of chairs. The doctor diagnosed him with just old age. A few years later, his walking became more of a shuffle, and then it started to feel like his brain was working, but his body just wasn't responding. Guess what the doctor said? Old age. Then, about 2 years ago, things got really bad. He was freezing in place while walking, losing a lot of weight, and having trouble speaking. Once again, the doctor said, old age. Finally, my grandma had enough and took him to a specialist in the city. The specialist took one look at him and immediately diagnosed him with advanced Parkinson's disease. He said, "These signs should have been progressively worsening over the past few years, but because he was misdiagnosed for so long, the damage was already done." The specialist said that all they could do was try an experimental treatment, which would only work for a few months before his condition would worsen. Unfortunately, my grandpa passed away this past February from complications of Parkinson's disease. And the fact that it could have been caught earlier still haunts me. If only that doctor had done his job right. Now, I've had my fair share of frustrations with doctors, but there are some experiences that take the cake. Like the time I was mistreated by my now ex-wife. I ended up in the ER after being brought in by 2 police officers and an ambulance. The police were amazing and professional, by the way. But when it came time for the doctor to treat me, I was shocked. She examined me and just kept shaking her head, making disapproving noises. "Why didn't you just get up and run away?" she asked, as if that was a reasonable question. She wasn't concerned with what had happened to me or how to help me heal. Instead, she kept saying things like, "You're not gay, are you?" Honestly, I didn't even know how to respond to that. She wasn't being professional, she wasn't doing her job properly, and she sure wasn't making me feel comfortable. She also didn't assign a forensic nurse, which I found out later is required by law in those kinds of situations. She didn't even ask if I needed counseling, something that's supposed to happen after traumatic events like that. It wasn't until years later that I found out I had developed chronic pain, severe anxiety, and PTSD from that incident, things that could have been addressed earlier if she had actually cared. The lack of follow-up was frustrating, but the worst part was that she didn't seem to care about me as a person. And you know what? I still don't feel like she got what she deserved for her neglectful treatment. And then there's the whole, if you have a crappy doctor, get a new one thing. My uncle spent 10 years seeing a doctor who clearly had no clue what he was doing. He never looked at him properly and barely did any tests. I took my uncle to the ER because he was really sick, and he ended up being admitted to the hospital for a month. The doctors told us his heart was failing and he had to be treated right away. But it was the same doctor who'd seen him just 2 days earlier, and he had missed everything. My uncle spent a month in the hospital, losing 65 pounds of fluid that his failing heart couldn't get rid of. A few months later, after he was discharged, he passed away. That's the thing, doctors aren't always right, and you have to advocate for yourself. If something feels off, don't just ignore it. Don't stay with a doctor who isn't giving you the care you deserve. If your doctor isn't working out, find a new one. There are good ones out there, but you have to do your part to find them. I'll pick up right where we left off. Things only get crazier from here, and I promise you, you'll be just as stunned as I was during some of these encounters. Let me start with this one. I had a dentist years ago who made me question my entire dental care experience. At the time, I was in high school, and I had braces. One of the things I needed to do was wear rubber bands to pull my canines into place. My dentist took one look at my setup, looked at the bands pulling my teeth, and said, "I've never seen that before." Now, if you're a dentist, shouldn't you have seen a lot of things by then? But here's the kicker. His receptionist kept getting calls about excessive wounds on patients. That was a huge red flag. But what really sealed the deal was when he told me that I needed reverse pull headgear to fix my slight underbite. Reverse pull headgear. If you're unfamiliar, that's the kind of device you wear on your head that pulls your teeth and jaw back into place. Picture an awkward teenager, already self-conscious, wearing a device that sticks out of their face. Not cool, right? Well, fast forward a few weeks, and guess what? This guy was arrested for using something on his patients that was illegal and unethical. Turns out, he had been using improper methods for a long time, and not just on me. He had been putting kids under for procedures that weren't right. After the whole thing came to light, we found out that he was being investigated for serious misconduct. I remember hearing about it on the news. It was honestly a huge relief that I'd found out before anything worse happened. Speaking of terrible doctors, let me share a bit about my experience with a family doctor. A few years ago, I started feeling really sick. I had these constant stomach cramps, nausea, headaches, and was completely unable to sleep. I was barely eating and struggling to keep anything down. I went to the doctor, and the first thing he asked was if I might be pregnant. I wasn't. I told him there was no way I was pregnant, especially since I hadn't been active in months. Yet, he insisted on doing a pregnancy test several times. After the results came in, he barely acknowledged the fact that I wasn't pregnant. Instead, he just told me I wasn't pregnant. Like that was some sort of breakthrough. No tests for anything else, no follow-up on my other symptoms. Just well, you're not pregnant. And that was it. I felt like I had just wasted my money. No prescriptions, no advice, nothing. It took a lot of time, but I eventually got better by hydrating and resting. Still, that doctor's complete lack of effort left me searching for someone who could actually help me. Now, here's a story about a doctor who absolutely failed in a moment of crisis. My wife's mom had a persistent cough that wouldn't go away. This doctor initially diagnosed it as allergies and gave her some Claritin. She kept getting worse, so she went back, and this time he prescribed her cough medicine. Yet her condition continued to deteriorate, and soon she was having trouble breathing. She went to a different doctor, and this one immediately admitted her to the hospital with pneumonia in both lungs. The worst part, when she later asked the first doctor why he hadn't caught it, he said, "I am amazed that your doctor didn't catch this. It's immediately noticeable to anyone with any medical training. How does that happen? How can a doctor miss something so serious?" Pneumonia isn't something that you can just miss, especially when a patient's condition is so obvious. But this story isn't just about medical incompetence. It's about how these doctors impact lives when they don't do their jobs properly. My wife's mom was lucky enough to find a doctor who did care, but that could have been a life or death situation. Let me throw another example your way. My grandfather had a heart attack, and the paramedics were called. They checked him out and confirmed that he was having a heart attack, so they put him in the ambulance. However, they ended up waiting outside in the cold with him for 30 minutes. Why? Because they just couldn't get their act together. My dad had to walk over to the ambulance, knock on the door, and ask what was going on. Apparently, they were having trouble finding a vein for the fourth. It took forever, and the situation only worsened. The real kicker, they almost passed the hospital. My dad was the only one to notice, and he started yelling at them to turn around. He was freaking out. And honestly, I don't blame him. That's just the kind of care you can expect sometimes when everything goes wrong, and no one seems to care about the urgency of the situation. So, after all of that, I started to become a little more suspicious about my own medical care. If I've learned anything from these experiences, it's that you need to be proactive. You can't just trust any doctor. You need to be informed and speak up when something doesn't feel right. Whether you're in an ER or sitting in a routine checkup, trust your instincts. If something feels off, don't just brush it aside. Speaking of brushing aside concerns, I have another one for you. A few years ago, I went to see a doctor with an intense rash on my leg. It wasn't a big deal, but it came back every once in a while, and all I needed was a steroid cream. I figured a new doctor would just look at it, prescribe the cream, and be done with it. But no. The doctor walked in, didn't even talk to me or look at the rash, and immediately told me, "You have diabetes." I was in shock. I had no symptoms of diabetes, none. It didn't run in my family, and my rash had nothing to do with it. But she insisted. "You have diabetes," she said. Like it was a diagnosis she could just drop on me without any tests or reasoning. I kept telling her I didn't have diabetes, and she kept pushing the idea. She even said I needed to start taking medication right away. I left that office in total confusion, feeling more stressed about the idea of a serious illness that I didn't have than anything else. I went to another clinic for a second opinion, and guess what? I wasn't diabetic. I was just dealing with a skin rash. How does that even happen? How can a doctor be so wrong and yet so forceful about it? It's funny how some people can be so adamant about things they don't understand, isn't it? I've learned to never just accept a diagnosis at face value, especially when I know something isn't right. It's crazy how quickly one wrong diagnosis can spiral out of control. We've made it to the final part of this wild medical journey, and trust me, I'm saving some of the most jaw-dropping moments for last. This is where things get even more unbelievable. Let me start with something that might sound like a relatively small mistake, but it left me feeling like I was in the Twilight Zone. I went to my doctor a few years ago, fully convinced I had broken my foot. I've broken plenty of bones in my life, so I know the feeling. I told him exactly what happened. I fell off a flight of stairs and landed on my foot at a weird angle. But what did he say? "Oh, you just pulled a muscle." I knew something was wrong. I'm no doctor. But I've broken bones before, and this was different. But he insisted on sending me for x-rays. Fine. I figured I'd humor him. Sure enough, when I saw the specialist, it turned out that I had a broken foot, along with a shattered heel. You know that feeling when you know you're right, but the doctor still brushes you off? That was me. The x-rays revealed the truth, and I had to go through months of treatment. I should have just gone straight to the orthopedist from the start, but instead, I had to suffer through a few weeks of pain and misdiagnosis. I guess it's pretty safe to say that I don't trust doctors who just throw around muscle strain diagnoses without actually doing their homework. After this experience, I vowed to always get a second opinion when I'm dealing with something that feels off. Speaking of second opinions, let me share an absolutely absurd encounter with a new doctor. I had a rash on my leg, something that wasn't unusual for me, but it had been recurring, so I figured I'd show it to a new doctor. All I wanted was a prescription for my usual steroid cream. But the doctor looked at me, didn't say a word to me, didn't ask about my medical history. and then dropped this bomb. You have diabetes. What? I told her. No, I don't. I don't have diabetes. I just have this rash. But she wouldn't listen. She insisted. No, you have diabetes, and you need to take medication right now. I was baffled. How could she be so sure without any tests or even a basic understanding of the situation? It wasn't like I had any symptoms of diabetes. No family history, no issues with blood sugar, nothing. I told her that I'd never been diagnosed with diabetes, and this was just a skin condition. She didn't even blink. She started talking to me about medications, the risks of untreated diabetes, and how my life would be affected by this diagnosis. I had to leave the office with her practically chasing me down the hall, still telling me I had diabetes and needed medication. That's when I decided to get a second opinion, which turned out to be the best decision I ever made. I went to another clinic, had some tests, and guess what? No diabetes. Just a simple rash that was easily treated with the right cream. Doctors are supposed to help us, not create unnecessary panic. That whole experience was a reminder of how important it is to stand your ground and make sure you're getting the right care. And don't even get me started on the whole I'm the doctor. So I know best mentality some doctors have. I had a friend whose mom went to see a doctor because she had been suffering from some back pain. The doctor quickly dismissed her complaints and told her that she just had a sprained muscle. He gave her Tylenol and sent her on her way. But the pain didn't go away. And when she finally went to another doctor, they found out she had a broken vertebra in her back and a herniated disc. How does that even happen? How can a doctor be so cavalier with someone's health and brush off something so serious? That doctor was so convinced that it was just a sprain that he failed to recognize something much worse. My friend's mom ended up needing surgery, and she still has to deal with the aftermath of that misdiagnosis. I don't even want to imagine what could have happened if she hadn't gone to get a second opinion. The lesson here is clear. If your doctor isn't taking your concerns seriously, get a new one. Don't wait until it's too late. And don't let anyone dismiss your symptoms without proper investigation. That's something I've learned the hard way more times than I can count. Now, let's talk about something a bit more serious. My uncle, who had been seeing a doctor for years, had no idea that he was facing heart failure. His doctor, the same one who had been seeing him for a decade, barely gave him the time of day. After a while, my uncle's health started to decline, and he ended up in the hospital for a whole month. The doctor didn't even seem to care that my uncle had gained 65 pounds of fluid because his heart was failing. My uncle's doctor hadn't caught it, even though the signs were clear. It wasn't until he was admitted to the hospital that anyone really took notice. That's when I learned another important lesson. Never underestimate the importance of a good doctor. You can't just settle for someone who doesn't pay attention to your health. If you feel like something's wrong, don't just ignore it and trust that a doctor will figure it out on their own. Sometimes they don't. After my uncle was discharged, we went back to see his doctor, and I stayed with him. When the doctor saw him, he barely acknowledged the fact that my uncle had just lost 65 pounds of fluid in the hospital. He barely said anything. My uncle's health had deteriorated so much, and this doctor didn't seem to care. It was infuriating to watch. My uncle passed away 3 months later, and I'll always be frustrated that his doctor didn't do more to catch the heart failure earlier. It really hit home for me that doctors can't be taken for granted. And just because someone wears a white coat and has a degree doesn't mean they know what they're doing. If your doctor isn't doing their job, find someone who will. As for my own experiences, I had one that took the cake. Years ago, I went to a doctor after swallowing a pushpin. Yes, you read that right. I was hanging up a poster, and I put a pushpin in my mouth to hold it up temporarily. I ended up coughing uncontrollably, and before I knew it, the pushpin was down my throat. I immediately went to the university health clinic. and I was seen by a doctor who gave me the most nonchalant advice I'd ever heard. "Oh, it's no big deal. You'll pass it in a few days. Just check your stool to see if it comes out." I'm not kidding. This doctor told me to wait a few days to see if I passed the pushpin through my stool. But what did I do? I went straight to the hospital, and when I got there, the doctors freaked out. They rushed me into an X-ray and found that the pushpin was lodged in my lung. Yeah, you read that right. I had somehow inhaled the pushpin. They ended up having to put me under and perform a procedure to remove it. And after the fact, the doctors at the hospital told me that the advice I had been given was not only bad, but it could have been deadly. The doctor at the health clinic didn't take it seriously enough, and it nearly cost me. The hospital staff was shocked that I wasn't treated properly from the start. And with that, we've come to the end of this roller coaster of medical misadventures. I hope these stories have made you think twice before you trust your health to just any doctor. It's a wild world out there, and sometimes it feels like doctors are just practicing, not necessarily getting it right. The lesson here is simple. Trust your instincts. Get second opinions. And don't be afraid to speak up when something feels wrong. Your health is too important. Thanks for sticking with me through all of these stories, hopefully. They've given you some useful takeaways, and maybe a laugh or two along the way.